My name is Paula Tubes. I'm a registered nurse, and I'm the administrator for home health, hospice, and palliative care at Tammany Health System. We're an extension of the hospital, and we provide care when people get out of the hospital, or maybe from the doctor's office. Even they don't have to be in the hospital, but most of our patients have been hospitalized here at St. Tammany, where our staff goes into the home and continues that care once somebody is back at home from their hospitalization or their physician visit or long-term acute care or even rehab. Our staff is made up of registered nurses, medical social workers, certified nursing assistants, physical therapists, occupational therapists, speech therapists. We can do just about anything at home. For example, if somebody comes out of the hospital after they've had a knee replacement or a hip replacement and need physical therapy for strengthening, or to learn how to use a piece of equipment, or to just get them to where they're able to come back to outpatient for therapy. That's one of the things. They're in the homes by themselves. They're working independently. Physicians, the emergency department, our office is a phone call away, but for that nurse to go in, or that therapist, or whoever it is, and make that assessment and be able to convey that information if somebody's having a problem, and figure out what to do with them, is essential. So they all have a good bit of med-surg experience, if you will. We also have some nurses that have pediatric experience, so we can see some of the kids that maybe go home with a surgery or an orthopedic problem. They have a minimum amount of supplies with them, anticipating what they may encounter on a visit, but generally, as we admit patients and we know what their plan of care is, we know what they're going to need, and then they'll bring those supplies with them. They also carry a laptop, so we have electronic medical record just like the hospital. So we're on Epic just like the hospital. They're able to do their notes, and anybody in the hospital can see them and see what's going on. We're able to get the information from the hospital when a patient goes home, so we're all sharing the same information and all up to date on what's going on with the patient. As you would expect with any home health agency, the care that is delivered is personal. We're in patients' homes. It's one-on-one. We all are there to provide that quality personal care. But the great thing about being associated with St. Tammany Health Systems and being a department of the hospital is that we have the resources, we have the incredible staff, the family of staff across the street to pull from, the expertise, the expectation of quality, all those things to provide an even higher level of care than one would expect.